To understand how this therapy works, we believe it helps to understand how the normal bladder functions. As the normal bladder fills up, it sends a little nerve signal to the brain, telling you it's getting full. Once in the restroom and ready to empty, the brain sends a bigger signal to the bladder, telling it to empty. The bladder contracts and, almost like squeezing a balloon, the normal bladder empties. Now, for some patients, as the bladder begins to fill, it's already telling the brain that it's full. The brain doesn't give you time to get there before it tells the bladder to go ahead and empty. This overactivity of nerve signals results in a miscommunication between the bladder and the brain, and this is the source of overactive bladder symptoms. The closer you get, the stronger the signal and the contraction, and the stronger the urge. Overactive bladder medications and Botox injections work on the bladder muscle to prevent or slow these abnormal bladder contractions. And for some patients, these therapies work just fine. Unfortunately, they don't treat the underlying source of the problem, which again is that miscommunication or overactivity of nerve signals. Now let me describe this miscommunication another way. I have some hearing loss. If my wife and I are having dinner in a loud restaurant, I have difficulty hearing her. The background noise interferes with our ability to communicate. Get rid of the background noise and I can hear her just fine. This therapy works by delivering a small electrical impulse that blocks out those inappropriate nerve signals, getting rid of the background noise, letting your bladder talk to your brain without that interference, thereby restoring that normal communication. And is thought to work the same way for bowel control. The first step with this therapy is the trial, which allows you to test drive the therapy for 3 or 4 days to see if it works for you. Now, let me describe the test procedure. The test procedure takes about 5 minutes and is done in our clinic. Remember, those little nerves that control your bladder and bowel function live down next to the tip of the tailbone, well below your spine and easy to get to. We look at your tailbone under X-ray and watch as we precisely place 2 little hair-like wires right next to those nerves. No incisions are required. We give you a little numbing medication, place those little wires just underneath the skin, and then tape them to your backside. We connect those wires to a small stimulator that you wear on an elastic belt for 3 or 4 days. Now, if your symptoms improve by at least 50% during the test period, well, it's likely you will do well with the long-term therapy. About 80% of our patients see significant improvement during the test and move forward with the long-term therapy. The long-term therapy is delivered by a small battery and wire similar to the heart pacemaker, implanted just underneath the skin. It's about a 20 to 30-minute outpatient procedure, and we do it right in our surgical suite. We use local anesthetic and just a little IV sedation, so you're comfortable, but you don't have to go completely asleep. The long-term wire is placed in the exact same place the temporary wire was located, again right next to those little nerves that live down by the tailbone. The small battery is placed about an inch or so underneath the skin, in the upper part of the buttocks, below your belt line but above where you sit. And that's it. A small battery and wire. Everything's hidden underneath the skin. No one knows it's there. And it helps you get long-term relief from bladder and bowel symptoms. Since it's outpatient and we do it right in our facility, you go home within an hour or so with minimal recovery. In fact, most of our patients are back to doing their normal activities within a day or so. Over 350,000 patients worldwide have been treated with this long-term therapy, and several thousand of our patients have benefited from InterStim. This therapy has truly changed the way we treat bladder and bowel control problems.